Picture this. The ground beneath you, the very foundation of your world, suddenly becomes a violent, roaring sea. Buildings don't just crack, they disintegrate. This isn't a scene from a disaster movie. For millions, it's a terrifying reality. In the blink of an eye, an earthquake can rewrite the story of an entire city. And the first chapter is always one of immediate, devastating physical impact. When the shaking starts, the most immediate threat is blunt force trauma. Collapsing buildings, falling debris, shattering glass, these are the first wave of assailants. We're talking about crush injuries, fractures, and severe lacerations. People are trapped, pinned under tons of concrete and steel, their bodies bearing the brutal weight of a city turned upside down. Then come the secondary hazards, like landslides triggered by the quake, burying homes and roads, and tsunamis, which can follow offshore earthquakes, engulfing coastal communities in a deadly surge. The initial moments of an earthquake are a lottery of survival, where your location determines your fate. The injuries are horrific and widespread, creating an instant mass casualty event that would overwhelm even the most prepared medical system. Now, imagine you survived the initial chaos. You're injured, or you're trying to help someone who is. Where do you go? The hospitals, the clinics, the very places meant to save lives, are often among the first casualties. An earthquake doesn't just harm people. It cripples the infrastructure designed to protect them. Hospitals can collapse. Power grids fail, plunging everything into darkness and rendering life-saving equipment useless. Roads and bridges are destroyed, making it impossible for ambulances to reach the injured or for supplies to get in. Doctors and nurses become victims themselves, or they're cut off from their workplaces. What you re left with is a catastrophic breakdown of the healthcare system precisely when it's needed most. This disruption isn't just an inconvenience. It's a second disaster, a silent killer that claims lives long after the ground has stopped shaking. Survivors with treatable injuries can die from infection or lack of care. Chronic patients miss life-sustaining treatments. The system designed to be a safety net is gone. But the dangers don't stop there. In the rubble of a destroyed city lies a hidden threat, a toxic cocktail of environmental hazards. Earthquakes rupture pipes and industrial containers, releasing asbestos from old buildings, hazardous chemicals from factories, and raw sewage into the streets and water supplies. The air fills with dust and particulate matter from pulverized concrete, which can cause severe respiratory problems for survivors and rescue workers alike. Contaminated water sources become breeding grounds for diseases like cholera and dysentery, leading to deadly outbreaks in crowded, makeshift shelters. It's a cruel irony. The very environment that once sustained a community becomes a source of poison, creating a public health crisis that can linger for months, even years. People are forced to live amidst this contamination, breathing it in, drinking it, with no easy escape. While the physical scars of an earthquake are visible and immediate, the invisible wounds, the psychological ones, can be far deeper and more persistent. Imagine the sheer terror of feeling the earth betray you, the deafening roar of destruction, the sight of your home turning to dust. This is a profound trauma. In the immediate aftermath, survivors often experience acute stress disorder. They're in a state of shock, disorientation, and intense fear. They might have flashbacks, nightmares, and severe anxiety. Every aftershock, every loud noise can trigger a fresh wave of panic. This isn't just about feeling scared. It's a fundamental shattering of one's sense of safety and predictability in the world. For children, this trauma can be particularly damaging, shaping their development and their perception of the world as a dangerous, unstable place. The mind, like the city, is in ruins, struggling to make sense of the senseless. As the days turn into weeks and months, the initial shock can evolve into long-term mental health challenges. Post-traumatic stress disorder, or PTSD, is incredibly common among earthquake survivors. The constant reliving of the event, the avoidance of reminders, the emotional numbness, it can be paralyzing. Depression and anxiety disorders often follow, fueled by grief over lost loved ones, lost homes, and lost livelihoods. The future feels uncertain and bleak. But here's the remarkable thing about the human spirit. Alongside this immense suffering, there can also be growth. It's a concept known as post-traumatic growth. Some survivors, after processing their trauma, report a greater appreciation for life, stronger relationships, and a renewed sense of personal strength. They face the ultimate test and emerge with a new perspective. It doesn't erase the pain, but it shows that even from the deepest abyss of despair, resilience and growth are possible. It's a testament to our capacity to find meaning even in the face of unimaginable loss. When a disaster of this magnitude strikes, how a community understands and responds to it is deeply shaped by its culture and beliefs. In many societies, religion and spirituality play a central role in coping with tragedy. For some, faith provides comfort, a framework for understanding suffering, and a community for support. Prayer and rituals can be powerful tools for healing. However, this can also manifest as religious fatalism, the belief that the disaster was an act of God or fate, something beyond human control. While this can help with acceptance, it can also sometimes hinder proactive preparedness and recovery efforts. Why rebuild or reinforce if fate will ultimately decide? These cultural and social dynamics are critical. The way we mourn, the stories we tell, the support networks we build, these are all part of the socio-cultural fabric of health. Ignoring them means ignoring a vital part of the healing process. Understanding a community's beliefs isn't just about cultural sensitivity. It's a core component of effective disaster response. From a public health perspective, an earthquake is a system-wide shock. It's not just about treating individual injuries. It's about managing a population-level crisis. The immediate priority is search and rescue, followed by triage, quickly assessing and prioritizing the injured. Then comes the monumental task of preventing disease outbreaks. This means establishing clean water sources, sanitation facilities, and vaccination campaigns in temporary shelters. It requires surveillance systems to quickly detect and respond to outbreaks of infectious diseases. Long-term, public health efforts focus on rebuilding a more resilient healthcare infrastructure, ensuring buildings are earthquake-proof, and establishing mental health support services for the entire community. It's a shift from reactive care to proactive prevention. An earthquake exposes every weakness in a public health system, forcing us to ask tough questions about preparedness, equity, and our collective responsibility to protect the most vulnerable. We can think of a city and its health system as a complex, interconnected system, much like an ecosystem or the internet. Everything is linked. When an earthquake hits, it's not just one component that fails. It's a cascade of failures. The power grid goes down, which means water pumps stop working, which leads to sanitation issues, which causes disease outbreaks. It's a domino effect. This is a core concept in complexity science. Resilient systems aren't just strong. They have redundancy and adaptability. They can absorb shocks and reroute functions. A city with only one major hospital, one power source, and one main access road is incredibly fragile. A resilient city has multiple, decentralized hospitals, backup power generators, and a network of roads. This analogy shows us that preparing for an earthquake isn't about building an unbreakable wall. It's about designing a flexible, intelligent network that can bend without breaking and rapidly reconfigure itself in the face of disaster. Beyond the statistics and the science, the true story of an earthquake is told through the lives of the people who lived through it. Think of the story of a father who spent days digging through rubble with his bare hands, driven by the faint hope of finding his daughter alive. Or the nurse who, despite her own home being destroyed and her family missing, worked for 72 hours straight in a makeshift clinic, saving countless lives. Think of the children in a refugee camp who, with just a few crayons, draw pictures not of the destruction, but of their homes being rebuilt, a powerful symbol of hope. These human stories are what give the data a soul. They remind us that behind every number is a person, a family, a community. They show us the worst of what nature can do, but also the absolute best of what humanity can be: courageous, compassionate, and unbelievably resilient. These stories are not just anecdotes. They are the heart of the matter. So let's bring it all together. Earthquakes are a profound shock to our world, unleashing a devastating chain reaction that impacts our physical health through injuries, our public health through infrastructure collapse and environmental toxins, and our mental health through deep, lasting trauma. We've seen how cultural beliefs shape our response and how, even in the darkest times, the human spirit can find a path to growth and resilience. We've also seen that by thinking of our cities as complex systems, we can design them to be smarter and more resilient. The stories of survivors show us the incredible power of compassion and hope. The threat of earthquakes is real, but so is our ability to prepare, respond, and rebuild. It starts with awareness. It starts with you. Learn about the earthquake risk in your area. Have a plan. Support organizations that are on the front lines of disaster relief. Advocate for stronger building codes and better funded public health systems. By taking these steps, we can help write a different story for the next time the ground begins to shake. Thanks for watching. If this video opened your eyes, please hit that like button, subscribe to the channel, and share it with your friends. In our next video, we're going to dive deep into the cutting-edge technology being used to predict earthquakes. You won't want to miss it. See you then.